now.
You know, there are so many wonderful nonprofits here in Chattanooga, all of them doing their part to make our community a better place to live. But we're going to highlight two of them for you this morning and then invite you to come out and join them in their efforts. Kevin Lusk is with Project Access. Bailey Frable is representing Volunteers in Medicine, and together they're coming back again for Golf for Good. Good to see you.
Good to see you too. Good morning.
Good morning. So both of you kind of provide your own little niche market, if you will, to sort of the underserved medically here in town. Bailey, Volunteers in Medicine is serving who?
So Volunteers in Medicine is a nonprofit primary care clinic, and so we provide just primary care to eligible adults in the area. We do have some multi-specialties, but we actually share a lot of patients with Project Access.
Okay, so then Project Access, Kevin, becomes kind of the specialty side
That's
of
exactly
things?
what we are. We have 33 partner clinics. Volunteers in Medicine is one of our closest. And if Volunteers in Medicine has a primary care patient that needs specialty care, they'll refer their patient to us. We find a physician, and it can be anything from a broken bone to cancer. We find a physician to provide the services for that patient. When the patient's well, we send them back to Volunteers in Medicine, and hopefully they'll get back to where they need to go.
So because you all are kind of on this seesaw where one goes up, you can't work in tandem with each other, it makes sense for the golf tournament now to partner. But you're talking with us this morning because there are still some spots open. This is not until September, and you're already selling out.
Yeah, the morning slot is already completely full, but we still have some PM teams available for the 2 p.m. flight, and then we do have whole sponsorship availability.
Okay, so let's talk a little bit about the day in, day out of what your lives are like, because the golf event in September is great, and that's a wonderful thing to highlight. But you're seeing real people every day who, if it wasn't for y'all, wouldn't have access to their medical care.
Right, and I mean, our patients don't have access to health insurance. Basically, they fall in that Medicaid gap, for lack of a better term. And they fall on hard times. They may have lost their jobs. They may have a health issue. They just don't have anywhere to go. And that's where Project Access and Volunteers in Medicine comes in. We are often a last hope for a lot of folks that need health care and just don't know where to go. And luckily that we have organizations like VIM and Project Access.
Every time you're here, I end up asking you questions. I think I'm repetitive, and I don't mean to be, but the healthcare industry and insurance is a tricky thing. It's not simple to understand. So when you mention kind of filling in that Medicaid gap, unless you're walking that path, you don't necessarily understand what that looks like. These are very often working people, but they just can't access insurance. Is it because it's just far too expensive?
That's part of it. I mean, part of it is a lot of folks that are employed they can't afford health insurance,
right?
Or their employer is not able to offer it for whatever reason. So that's where organizations like ours come into play.
It's an interesting thing, and not to, make anybody feel bad, but if you're lucky enough watching this morning to have good health insurance, say your prayers tonight of thanks, because so many people now, the premiums are high, and then the deductibles are almost unreachable, so you can feel almost like you're throwing your money away. So in the case where you're having to choose, do I eat or do I have health insurance, what do you do?
Yeah, that's where we're so fortunate to be able to provide free services at both organizations, because it is so true. A lot of people are choosing between paying medical bills or choosing healthy food or keeping doctor's appointments, and we try to get people in and kind of provide resources to all of that.
In terms of your service area, are you Hamilton County specific?
So Project Access covers Southeast Tennessee. So we cover Hamilton County and the surrounding, basically those that are in your viewing area that are in Tennessee, and Volunteers in Medicine.
Yeah, Hamilton County and boundary counties. Really, if you can get to us, we would love to provide care.
Okay, so now let's talk about the golf event, September 12th.
September 12th.
At Brown Acres. So you mentioned that you are looking for sponsorships because that's kind of how you keep this thing afloat.
Right. We're both of us. We're both nonprofits. We both survive on donations and grants and the like. And this golf tournament is just one way that we can bring the community together. One, to celebrate what we do, but also to raise funds for what we do. We have physicians, we have healthcare folks that are in the tournament. But another great thing about it is some of the patients, once they're well, they'll come back and they'll play in the tournament or they'll volunteer in the tournament to give back. So this is kind of a celebration of everyone that plays a role in this machine of what we do to come together and just celebrate.
Are you often helping people who are just looking for kind of help me get over the hump? Or are they often...
Maybe they've lost a a job or something and they've lost their insurance, and just until they can get back on their feet, we've definitely been kind of like a placeholder.
So if someone's watching this morning and this is a new path for them, definitely reach out. Don't wait until you're out of resources. Reach out.
Yeah, they can just stop by the clinic anytime and pick up an application. There's a very brief eligibility process, and speak with Eduardo, our community health navigator.
We want to make sure that we don't want to be needed. We want everyone to
Right.
have access to health insurance.
Yeah.
But until that happens, we want to be a lifeline for folks. There's no shame in asking for help, and we want to help you up front as opposed to when you get later down the road where you may have something that's going to be more difficult to treat.
Right.
That's where we come in. We just want to make sure that everyone gets the care they need and they deserve.
That they deserve. So here's what you can do. Why not spend a beautiful fall afternoon? It is going to be cooler by September. I think we can say that. At Brown Acres, September 12th. If you want to sign up to play, you better hurry, because as you heard Bailey say, those morning slots are pretty well taken, but the afternoon ones are open. If you're in a position to give, they would love to have you join them as a sponsor. VIM-chat.org, and then Golf for Good. Great to see y'all.
Thank you.
During the back-to-school sale at Furniture Row, every sofa, dining group, and bed is on sale. So outfitting your off-campus studio or secluded study nook is elementary. Find high-end sofas at unbelievable prices and laid-back sectionals with modern lines. Contemporary counter-height dining to versatile